Dr. Alicia Mousseau. She is an enrolled member of the OST tribe. She's also a resident of the Pine Ridge Reservation. She is our youngest member, I believe, of the OST Research Review Board. She's a research instructor with the Center for American Indian and Alaskan Native Health and the Colorado School of Public Health at the University of Colorado. Dr. Mousseau is currently the director of the Tawahe, what she said, project, which is a family-based substance use prevention program for 10 to 14-year-old Dakota youth and their families. Her other work focuses on examining self-regulation, effect, and substance use among American Indian youth, including examining mindfulness techniques to reduce risky behaviors. Dr. Mousseau is dedicated to promoting prevention and healthy equity in American Indian communities through our research and capacity building. That's it.
Thank you, Liz, for the introduction. My name is Alicia Mousseau. My parents are John and Vera Mousseau, and my grandparents are James and Lena Mousseau of Porcupine. And my godparents are Karen Spoonhunter Brown and Howard Brown of Arapahoe, Wyoming. So like Liz said, I am the youngest member of the RRB. So that would make these guys like my elders. And if you guys come to our meetings, it's pretty fun. And like I said, it's a hard act to follow those two because when they're up here, like when you're in our meetings, you can see them. And we know the jokes, the inside jokes, and we have friendly discussions, or it gets heated sometimes. But we always agree to disagree, or we always listen to each other, and it does come out for the better. So I just want to thank my fellow RRB members for raising me up. I knew a lot of them before I went to grad school, and they're continuing to help me grow and become a better researcher. So let me get my presentation pulled up here. So I'm a very proud member of the RRB. We do really try to ensure that our human subjects are protected, that our tribal members are protected, and that the research that comes through is done rigorously, but also with the context in mind. And we do that we give a lot of information to researchers, so we try to help researchers. We try not to be too, it may seem a little tense at times, but we are trying to help you guys out, and the Research Review Board also helps me out. So, because when I finished grad school in 2012, and I came home without a job. I came home knowing like I would be taken care of by the community because I had worked here before. I'd done diabetes prevention and youth mentoring. And so I came home without a job, and I knew that my community would take care of me, and thankfully the RRB picked me up and I got some consulting gigs. But it's just that connection and that maintaining those relationships that has helped me become a better person, researcher and community member, and hopefully relative to my friends and family. So today I would like my presentation styled Old Indian Tricks, American Indians in Research. And I titled my talk that because sometimes as a researcher and as an American Indian, I don't have necessarily any identity crisis with it. It seems very natural. It goes hand in hand to me. But sometimes when I'm reading in the literature or sitting in certain meetings, sometimes it feels like I can only be one or the other. And to me, I don't think I have to be one or the other. Those are both part of my identity and who I am and how I live my life. So I thought there would be some, there's this thing. Okay. So I thought there'd be some younger people in the audience. And so, of course, like a good researcher, and you guys can't see the top, but I did my research and Googled old Indian tricks. And I also thought there'd be younger people here, so they'd appreciate my Urban Dictionary reference. But when I Googled it, this is the first thing that came up, Urban Dictionary. And I thought the definition, although Urban Dictionary is not a reliable resource, and I wouldn't recommend that, but the definition is, I liked it. It's the general answer to how you did and or accomplished something. So the example they give is man one is like, dude, I didn't know that was the perfect gas oil mixture for my weed eater. How did you know? Man number two is, it's an old Indian trick. And I feel like Old Indian tricks, you just know. They're things you just know, and you know it by trial and error, by observation, and they're things that American Indians and other indigenous people, we just know. We've experienced and we've observed, and our ancestors have set us up so that we are still here today. And Old Indian tricks also, crap, I keep moving on this and not that, sorry. So this is a Time magazine article called, it's about a Latin American tribe or indigenous population that used to wrap their fresh meat into papaya leaves, and it was tenderized the meat, and they may not have known the specific reasons to why the papaya leaves tenderize the meat, and modern research has figured out that papaya leaves have enzymes that are similar to the digestive system, so that helps to break down the meat. But they knew that papaya leaves tenderize the meat. And so the Time magazine article, the title is Old Indian Trick, Modern Living. So those things we do know. We have in our American Indian communities and indigenous communities, there are things we've known for years and years, and that is how we have survived and made it here. And so some of the things that American Indians, the history and evolution of research in indigenous populations, there's some basic things. So if you look at like Maslow's hierarchy of needs, there are things that we need to figure out. But figuring those things out takes a lot of understanding and science and observation and knowing how to hunt, how to gather. If you're a nomadic lifestyle tribe, knowing where the buffalo go, knowing where the different animals that you come go, during what seasons, how to move, how to follow different patterns in the environment. And so those things aren't, sometimes you would think they're intuitive, but I don't know how many people have gotten lost in especially the Badlands. If you're not able to know that the sun goes east or west, or just intuitively be like, oh, okay, and follow and figure it out. Those things, it's science, and it's things that our people have known for a very long time. And sometimes we say, oh, it's just, human nature, but our people were scientists, they're researchers, and they understood things. Another thing that our American Indians have developed is this relationship model, which is something that's super interesting to me and super smart, just super smart, like the kinship and intertribal relations. So the kinship and being able to have people set up so that we knew that our relationships are very important. Having multiple parents, so your mom's sisters are also your mom, and your dad's brothers are your dad. And we set that up so that our kids would have this large network, not just a nuclear family where it's mom, dad, kids. We have large networks of people that were set up to ensure our safety, our security, and to help our kids grow up in that environment where they feel safe and secure. And we're looking at that now in our research of, what in our communities do we need for our kids? Do our kids feel like they belong in our communities? Do they feel like they have families? Do they feel connected to people? And our ancestors knew that. So we set up these intricate kinship systems where people knew you could go to the next house. Or nowadays it's like go down the creek, right? Like you can go down the creek and go to somebody's house and that's your auntie, or so we still have those connections today, but our ancestors set that up, and it's just super smart. And the intertribal relationships, and that's kind of connected to the language piece, is like the different dialects of our language. And today we're still studying our language and figuring out how to preserve it and how to best teach it to our people so that we can get more fluent speakers. But those were set up before, the language and the different dialects for our different relatives. And also spirituality. Knowing like those ceremonies. And sometimes it's really hard to think of spirituality and science similarly. But just, I don't know if you guys know about placebos, but sometimes just believing in something makes it work. So our ancestors knew about belief, and they had such a strong belief that our ceremonies were, and spirituality was super strong. It was a part of our lifestyle. It was just part of our daily life, things that we did. We lived our life in spirituality. And today we're still trying to continue that in this modern world, and we're trying to figure out the places and the times, but I do think that we still carry that with us today, and that was set up by our ancestors. And then the different adaptations. Today we have many different circles in our communities and spiritual circles, and those have been adapted throughout, and we're still continuing to adapt and figure out what works best for us. So, and then innovations. Our people were super innovative. When we had something introduced to us, we figured out how to use it the best. So the example up there is the buffalo, and people think, oh, that provides all the basic things, but that was introduced to us and we utilized it. We utilized every piece of the buffalo for our daily living. And that is what modern day would call sustainable or being green. We may not have had those words, but we definitely lived by those things. And we talked a little bit earlier about how sometimes words today don't match up to what was happening in the past, but they're still the same thing. And just learning how to navigate in between those two and make it work for you today is what we were talking about earlier. So innovation, so when the horses were introduced, we figured out how to use horses the best to our ability. We became excellent horsemen. Dogs were our first horse, so they would carry our travel away with all of our stuff. Just very innovative, very thinking creatively, thinking about what the best way to, if you're nomadic, how do you pack up your house and go, Today we have RVs, we can jump in those and drive off, but, the teepee was the best nomadic home. You can pack it up very quickly, set it up pretty quickly, put it on a travoy and go. So the innovation that our people had was also very scientific. And then adaptations, we continue to adapt. We continue to, like I mentioned earlier about the language, about different spirituality ceremonies, things we're doing today, about our language, or about relationships, how we're trying to carry that on today. So we're continuing to adapt, and we may not see it as scientific, but it definitely is science in nature. And then finally, we're resilient. I mentioned earlier that our people were scientists and super smart, and that's why we're here today. So we're continuing to use those different methods of observing and adapting and using science, whether we know we are or not. So some other examples, some other traditional therapies from other indigenous communities that have been used are acupuncture. And Wayne was talking earlier about using acupuncture and how different tribes have used acupuncture. They may not have called it acupuncture, and they may have used different means to do the acupuncture, like porcupine quills or different pieces of rock, shards of rock. But it's been used throughout different indigenous populations. And now you can go to acupuncture or a chiropractor and use your insurance card, right? Because it's been shown to be effective in different ways. So there are some traditional therapies that we use today in modern medicine and science that were shown to be effective through different mediums of science. Some more osteopathy and homeopathy and Tai Chi. So there's some Tai Chi examples over there that I just put some different examples up. And yoga and naturopathy and thermal medicines. And the last one on there is mindfulness, and that's some of the work that I do. I look at mindfulness in youth and for self-regulation, and this literature is blowing up, and I just presented at Sanford a couple weeks ago about my research study on mindfulness. But there are so many different programs popping up around mindfulness. You can get trained to be a mindfulness facilitator. You can go into schools and do mindfulness. You can learn mindfulness yourself, going on retreats and things like that, and do through training courses. And so some of these traditional therapies have been shown to be effective. And they've been shown to be effective and are used more. And you can utilize your insurance or other things for them because of science, because science has shown that they are effective. So they've been shown effective via today's research. So today's research There's many different research designs out there, different ways to do research. And these may not be the words that are, we use for traditional research, but these are different ways that are out there to do research. So on the far, your guys' right side, is qualitative, and that's more interactive and non-interactive. It can have two arms, but it's more ethnographic and phenomenologic. I can't even see the word. It's case studies, so observing individuals and how they respond to different environments. It's grounded in theory, and they're critical studies. So you observe and look, and then it can also be non-interactive, where you look at concepts and you do historical analysis. So you look at that previous accounts of things. So that's qualitative. On the left side is the quantitative piece of research today in different designs, and it can be experimental. So a true experimental study is where you have a control and an experimental group, and someone gets whatever you're testing and the other does not. And you're trying to see if the people who get the intervention or treatment or whatever you're giving them has more effect than the people who don't get it. So those are experimental designs, and sometimes those are held to the gold standard. And that's what we use to decide with medicines and different things, and sometimes actually medicines get through without that. But those are the experimental, and sometimes they're called the gold standards. And we hold things to a very high, rigorous, scientific when we do those types of studies. They can also be quasi-experimental and single-subject experimental. And then we also have non-experimental quantitative research, and this is descriptive or comparative or correlational studies, where you run some analysis and look how things are correlated, but they're not cause and effect. They're just, they're correlated. When this happens, these other things tend to happen as well. They can also be surveys, so where you give surveys, you're not necessarily given an intervention or a treatment. You're just giving a survey and seeing how people respond. And it's also ex post facto, so you can look at things after the fact. And then in the middle, when you merge quantitative and qualitative together, you get a mixed method design. And sometimes that can be explanatory, exploratory, and triangulation. And a lot of times in indigenous research, we use this mixed method because it brings in the people's voices. So we get to listen to people and how they respond and how they like certain things and get their point of view. And we also bring in the numbers. So we give them different measures and see how they respond on these different measures. If it's diabetes prevention, we'll look at their different levels, blood work levels, and then we'll see how they like the intervention. And then we'll come up with the best solution for them using these two different scientific methods. So these are different research methods of today. They may not have been described as that for our ancestors, but I do believe that our ancestors were excellent scientists and utilized these research designs. So use of research. So once we do the different research studies that we do, whether they're quantitative, qualitative, or mixed, how do we use that research? And that's one thing we ask with the RRB is like the benefits. I know Wayne talked about the benefits. What is this going to do for our tribe? And if you look at this, there's direct versus indirect. There's conscious versus unconscious. There's informed versus support decisions, and there's timing. But all of these say all these types of research can be used. I think I'm a firm believer in figuring out how to use all research, and I think we can figure out how to use it to our benefit most of the time. It's just sitting down with it and figuring out where it would be most useful and being creative with it. So the direct versus indirect is decisions are made based on research. I mean, a lot of policy is made. There's actually, I think it's Robert Wood Johnson does a lot of policy work with health disparities, and they look at how to change policy based on what you find in the research. Research can have that kind of direct effect on policies, and like school lunches are kind of one of them. I don't know how much Michelle Obama used the research. I'm sure she did. I trust Michelle. But just knowing that whole grains are better for us, and we did that through studies, trying to get our kids leaner meats, talking about portion control, those things have been studied and looked at, and they're being implemented in policies in schools and nationwide. What state was that banned, the mayor banned like larger than so many ounces of soda?
New York City.
New York City. So those things are being actually implemented in policy from what we find in research. So the conscious versus unconscious, so sometimes decision makers are to different degrees aware that they're using research. And they may not directly go to policy, but they're aware of it, and it can be used to sway them if we do it correctly, if we can work the systems. Inform versus support decisions, so where research is used to persuade or support existing thinking. So this is where the indigenous ways of knowing, we can utilize research to help support some of the things that we do, the kinship models that we use. In our current study that we're doing, we are implementing, we've culturally attuned the Strengthening Families 10 to 14 program, and instead of using nuclear families, we're looking at the extended family. So our research can show that the Lakota kinship model of including everybody, because there's aunts in the house, there's grandmas in the house, there's grandpas in the house, and utilizing our Lakota kinship model, we can justify and persuade supporting existing thinking about our current, about our indigenous ways of knowing. And then finally, timing, where research is used immediately or in the future. Sometimes research can be used like right away. So I know with the centers that I work at, the Centers for American Indian and Alaska Native Health, we have done a lot of preliminary research. We've had a field office here for quite a long time. And the research we've done and conducted, we did a lot of survey data in the beginning, a lot of epidemiological stuff to kind of gather a lot of information. And then we take that information, and we've been currently implementing different intervention and prevention programs based on that information. And I'll talk about that a little bit later. So it may not seem like research is being used like right now. Like you may be saying, oh, here's gathering a lot of data from us, but that data can be used to bring in more programs that can help combat those things. And we could look at those numbers again later. And research takes a long time. So in my lifetime, I'll probably get maybe 4 good research projects done in my lifetime as a researcher. So it takes a long time. So we kind of run on Indian time. Hey, just kidding. In that it takes time, we take a lot of time to look at it and review it and see where it can be applied and what we can do to combat those things. So the timing may not seem very immediate, but eventually that research can be used. So that leads me to current research in American Indian communities. And there's a lot. So we talked about the direct and indirect links in the previous slide. And so with the different information that we've gotten from different research and different epidemiological studies that have shown American Indians have high smoking, high rates of diabetes, high rates of different things. These are some of the different programs and research that has come out of that previous research. So the first one, and I pulled a couple, I didn't pull all of the different areas, but some of the ones that we have the highest smoking, highest rates of and are smoking. And so the first on there is the All Nations Breath of Life Smoking Cessation Program. This is out of the University of Kansas Medical Center. And they developed a program that is it's not culturally tailored because it's looking at heterogeneous populations of American Indians and utilizing traditional uses of tobacco. And they continually bring in the traditional uses of tobacco in their education program. And so they developed that based off of the previous research that showed that we have high smoking American Indians. Another research study is the Menominee Culturally Tailored Smoking Cessation Treatment. And that one is also based off of the previous research. And they are tailoring it to the Menominee Nation, so it's specific to that nation. And whereas the All Nations Breath of Life is more for the heterogeneous populations of American Indians across Oklahoma and Kansas. So different programs are coming out of the research specifically for specific tribal nations because we can't always lump us together, and some for heterogeneous areas. And then It's Your Life, It's Our Future project in Northern California is another smoking cessation program with youth. And Giving American Indians No Smoking Strategies is another smoking. And I forgot to mention our Black Hills colleagues, because I couldn't find your stuff in the literature yet, but they also have a study that they've conducted on smoking in the home. And there's a poster. And Liz is telling me to refer you guys to their poster to see what their preliminary results are. So from the previous research, we have direct links back to providing these different interventions and prevention programs to help reduce smoking effects in our population. And one review, the conclusion was, however, was rigorously conducted randomized control trials of culturally specific smoking cessation interventions are sorely needed, but will only be accomplished with the commitment of funders, researchers, and collaborative trusting relationships with the community. So I appreciate that, and it's saying like we need more rigor around our research when we do conduct these things. And I think we can do that. And I think these programs, we can rigorously study these different type of smoking cessation programs to see what's the best for us, because ultimately when we do rigorous science, it's to see what is the best for our people, what is going to be the most effective for our people. And if we're giving them something that's not effective, why would we continue to do that? So, so I think that was a good conclusion on that part. And also, it needs funders and researchers and collaborations. These things don't happen without money. They don't happen with collaborations between tribes and researchers. And also the trusting relationships, building those so that you can talk to people, you can get valid information from people when you're asking them questions. So I think that conclusion sums up a lot of how we do research and how we can do research better. So moving on to diabetes, that's another area that has been identified in American Indian populations as being very important. We have high rates of diabetes. And the United States Diabetes Prevention Program was conducted, and that was out of the NIDDK, and they had a curriculum that they used, and it utilized healthy eating, weight loss, exercise, and it was shown if people reduced their weight, or met their weight goal, which was 7% of their body weight, that they reduced their risk of diabetes by 58%. So being able to put a number on something, like if you meet your 7% weight goal, because I did this work before I went to grad school at Lakota College, and I felt really confident telling my clients, if you watch your eating, and I'll give you calorie goals, and I'll help you figure out how to plan your diet, and help you find foods that will fit into your calorie goals, and then you can exercise, and we'll teach you different ways to exercise, we'll help you exercise safely, and if you do these things and you reduce your weight by 7% of your body weight, you can reduce your risk of diabetes by 58%. Like, being able to say that to somebody gave me so much confidence in what I was doing, and it helped me to have confidence in the curriculum, and then help my clients have confidence in me and know why they were doing what they were doing by saying 58%, you know? So putting those numbers on things helps people. Sometimes numbers can be very mechanical, but being able to have that confidence sometimes helps to deliver. So out of that study, out of the NIDDK study, is the Special Diabetes Program for American Indian Diabetes Prevention, which is the SDPIDP. And I know a lot of tribes have this. I think our tribe has this, where it is now, that first study, the U.S. Diabetes Prevention Program study, was so robust that they said, okay, now go out and implement this in communities. We know it's effective. If you do it, it'll be effective. So go out and start implementing. So they gave a special one for American Indians, and that is what's being implemented because it had such robust effects in the original study. So some other research out there that has direct links from the previous research that's been done. Sexual risk. There's a lot of study on sexual risk and STIs and HIV in American Indian communities, and the populations that are at most risk. So 14 to 24-year-olds are at highest risk for contracting STIs. STIs are some of the highest communicable disease passed along. So some of the highest diseases pass from one another, and the rates are increasing. And specifically, the CDC put out a report, I can't remember how long ago it was, but in South Dakota, American Indians have some of the highest rates of STIs. Additionally, they named counties rates of STIs, and one of our county is the second highest in the nation. So unfortunately, we do have those numbers, but fortunately, from that research, we can develop different programs and implement programs to help reduce those numbers. And one of them is the Circle of Life, and I know that the Northern Plains Tribal Chairman's Health Board, is that what they go by now? Okay. I know that they have a program that they're implementing as well. I don't know if they have any data out yet, but the Circle of Life does have some data out. That's out of our Centers for American Indian Alaska Native Youth, or Centers for American Indian and Alaska Native Health. And the Circle of Life is implemented with 10 to 12-year-olds, and it has shown to have no effect on sexual activity. However, the effects are delayed onset of sexual activity. So we have shown that the COL project has delayed sexual activity, and it's mostly delayed sexual activity with those who got the program at an earlier age. So what that's saying to us is that we need to get kids at a younger age. So from this study, we're going to probably do spin-offs. And, so once you do studies, you can always do spin-offs and learn more things. So if we know that kids at a younger age are having longer delay, then we need to maybe not go to 10 to 12, but go to 8 to 10, right? So we need to get those kids at 8 to 10 rather than 10 to 12. So research, we can always find things, to new ideas and new things to look at and how to implement better and have better effects. So I know also suicide is another large problem, and there are quite a bit of different techniques to use, and out of the different literature on suicide, we have the Empowering Our Spirits program, which is out of Johns Hopkins University, and that is a program that helps youth feel empowered, and it's culturally tailored. I think it's out of White Mountain Apache. Is that right?
Yeah.
Yep. So they're specific to that population, and they're looking at the outcomes of that currently. Also the toolbox, and I'm not even going to try to pronounce that, but it translates to the toolbox, and it's another program that is being studied, and that one is out of Alaska. That's done with the UPIC, and that one has been shown to have good effects, and that one is a 36-module program, and that program helps to strengthen community members, individuals, family members. So it's trying to target the larger picture of the UPIC people and how to give them tools, and it teaches them, like they go on hunting trips with the boys and different things like that. So it's incorporating their culture into this suicide prevention program, and then they're then doing studies to see if it's effective or not. So it's pretty cool. And then finally, we have the American Indian Life Skills, which is Dr. LaFramboise. That has been around for quite a long time, and it's utilized. It started off as a Zuni Life Skills program, so it was specifically for the Zuni Nation, and then they made some modifications so that it can be used across different tribes and different American Indian populations. And that one is used for 14 to 19-year-olds, and it has 28 to 56 lessons, so you have the options of choosing different lessons, and you can go the full 56 yards for the 56 lessons, or you can use 28, so it's kind of nice that you can weave and use what you need to out of that lesson, or out of that program, and it's been shown to reduce substance use, suicide in certain populations, so. And then finally, I'm giving a shout out to our Sanford folks who are here and who are helping, the Cricket folks who are helping us with this research conference. We have sudden different infant death syndrome. So we have the Safe Passage study, which is a huge study looking at sudden infant death and the different different effects and relations to sudden infant death. And they're just now putting out some literature and information on that. Some of their current literature talks about the retention rate that they have, which is super high and super impressive. I think they have a 2% dropout rate, which is amazing. Kudos to you guys for that because it's super hard to retain people over a long period of time. So definitely I want to see the literature on that and how you guys keep your folks enrolled and involved. So those are just some of the research that's been done in American Indian communities that has been from previous research or from previous anecdotal evidence that people have told us. And then research has gone that next step to be like, okay, well, how can we help this? How can we increase health equity and reduce health disparity? So, however, there are gaps in the literature, especially with American Indians. And there's some theorized gaps and there's some real gaps. And I don't mean to say real, emphasize like that, but there are things that we struggle with as researchers that really make us pull our hair out sometimes of like, how do I figure this out? Or, and it takes creativity. But some of the theorized gaps in the literature are the indigenous ways of knowing, or indigenous traditional knowledge is another way that people talk about it. And indigenous ways of knowing are just, we kind of talked about a little bit earlier about how you just know certain things. And it's more of anecdotal, and there's no systematic or epistemological parameters around. There's no causal relationships that we can identify yet. But my question for this is if these things are, the indigenous ways of knowing are, what do we and don't we want to know about them? Do we really want science to tell us what we do and don't know about them? Do we really need that validation from science for these things, or can we individually, know to ourselves that it works for us? Because with great power comes great responsibility. For those stats nerds, I hope you got that. But with great power comes great responsibility. So if we know that certain things are effective or not effective, I mean, we can apply for funding, yes, if we know certain things are effective. But then what does that do to those indigenous ways of knowing? It puts them out there. Wayne talked about earlier, like, be careful what you put out there. People are going to know. And that's okay, but then also the funding opportunities. Am I going to start applying for grants to fund these things, this indigenous ways of knowing? And then what does that indigenous way of knowing become after I apply for those grants? Does it become a business? Does it become something that I'm continuing going to look for funding for? So those are some questions that we as indigenous people need to kind of, and especially indigenous researchers, need to have those discussions about. And also, what if we don't find any results from the indigenous ways of knowing? We could always say science, you guys don't know, or you did the science wrong. But then what does that mean to us as indigenous people? So it kind of opens up this Pandora's box, or this can of worms, if you will, if we do go there with some of those things. So those are some of the questions I have about those theorized gaps in the literature of indigenous ways of knowing. The next one, theorized gap in American Indian research, is cyclical versus linear processes. So just to give a definition, the linear worldview is logical, time-oriented, and systematic, and it has core of cause and effect. That's really what we want to do, is we want to do it in a timely manner. We want to know what causes what. But the cyclical worldview, it's intuitive, it's non-time-oriented and fluid. It's about balance and harmony. A lot of people use the medicine wheel, or Madakyase, or decolonization is another way to talk about it. But the cyclical worldview of getting out of that time-oriented, get here, do this, methodical way of thinking. But my question for this is, I know the medicine wheel has been used in a lot of research. Circle of Life used the medicine wheel to help understand, and I think as researchers we're coming along to incorporate everything. We know nothing happens, isolated, nothing is isolated. But it's trying to figure out how to capture all those things those moving pieces that work together. And so I don't think linear and cyclical worldviews are actually separate. I think that they can merge together because, like I said, I in my career article, I have like good 4 studies that I crank out and learn from and produce stuff from, and that's not a lot of time. That's so. I mean, even though we think of research as linear and it's time sensitive, like it takes a lot of time to produce really good research and get what you need to out of it. So I don't think linear and cyclical worldviews are separate. I think they can like weave in and out of each other and coexist together. So next theorized gap in American Indian research is sovereignty. We want to protect tribal members and entities, and Wayne talked about that earlier, about why we established our research review board. And we are one of the only tribes that has a research review board. But always when you're doing research, it is very important to remember the tribe you're working with and their sovereignty and their rights as sovereign entities. I honestly don't think that is a problem or gap, because maybe for those tribes that don't have research review boards, that they need to have conversations, but I feel like setting up a research review board is what we have, it helps those conversations. It helps us remind researchers about that sovereignty, about our ordinance as a research review board, about being sensitive to those different things in the environment. Sometimes with the sovereignty debate, they talk about research protocol as a tribal protocol, and to some extent that's true. It's not tribal politics, for sure. Research is not tribal politics. But research protocol, there's protocols. We all follow protocols, and research has its own protocol. And to understand research protocol, it's not tribal protocol, but as we talked about earlier in my talk, we've been scientists for such a long time. It's kind of intuitive, and it's also something that we've done for a very long time, so I'm not sure that research protocol isn't necessarily tribal protocol. And then finally, other people can't solve our problems about sovereignty. People come in and do helicopter research. They definitely, without that understanding of the environment and the people, they definitely can't solve the problems, or their results maybe not have the full picture. But we also do need that collaboration, because I know at the University of Colorado, where I work, the centers, I have so much support there, and so much other researchers who I can go to and ask about different things, and they all work in tribal communities, so we all know the different protocols, and then we partner with tribal programs and the tribes, so other entities can't solve our problems, but together we can solve our problems and try to figure out the best way to address them and move forward. And then finally, this is a gap in American Indian research that some of us as researchers pull our hair out with, and it's cultural identity. So there are things that we come across when trying to measure things, and we have a measure for almost everything, and we try to measure cultural identity, but it's really, really hard. And so what is cultural identity? Is it our practices? Is it our residence, where we live? Is it acculturation, how enculturated I am or acculturated I am? Is it values that I carry with me every day, whether I go to work and still treat people respectfully? Is it a certificate of Indian blood? That is something that tribes are mulling over, especially the tribes with a lot of money. Like what makes you Indian? Your blood quantum. And Chris Eaglehawk, he gave me one of the coolest definitions of culture, and it's knowing right from wrong. So I have to give a shout out to Chris there for that. But how do you capture that? As a scientist, how do you capture knowing right from wrong? Is it through values? Is it through your practice? Is it through how much Indian blood you have? So we're still, as researchers, trying to figure that out, because we want to know if cultural identity is protective, how cultural identity plays a role in different interventions that we do and prevention programs. So this is one of the gaps in the literature currently that we're trying to figure out. So how do we build bridges? We talked about some of the gaps. So how do we merge those gaps of Indigenous ways of knowing and sovereignty and the other things that the theorized gaps to research? How do we make amends? And I love these, the American Indian College Fund, their advertisements for their the scholarships and things they do and getting Indians to college. So to think Indian is to make eco-buildings with spruce root or rebar, and to think Indian is to grow radishes on the moon. I really like this because we do have indigenous ways of knowing. It's just trying to be creative and how to incorporate that into the framework of research, the framework of what we have today. How do we use creative ways in what we know and what's out there and make and do amazing things. Some other things that are happening in research. So there are Native researchers out there who are coming up with different models to look at things and putting them out there for people to try to follow whenever they are doing their research. There's quite a bit of literature on how to look at things from an indigenous point of view, how to work with tribal governments, how to work with research review boards, and how to make your research understandable to the community and think about all of those different cyclical things we talked about in our environments, but also put it into the linear model of how do we work through this and make sure we cover all these pieces. So Walter Simony and Evans Campbell, they're out of the University of Washington. They came up with this stress coping model, the indigenous stress coping model. So they talk about stress and then coping, the different cultural buffers. So they talk about those things, and we're still trying to figure out that cultural identity thing. So it can hinder that piece a little bit. And then what health outcomes happen from helping with coping or not helping with coping. So that is out there. There's also the indigenous research paradigm, which is a conceptual model. And this is used on a larger scale, not with just indigenous communities, but it looks like a lot of community-based participatory research aspects that are in there. I'm sorry if it's hard to read, but as you can see, there's a lot of pieces to this, a lot of things to think about, and it starts with the heart. It starts, in the middle, it starts with where you are, because like we talked about earlier with the smoking program, there's some that are for heterogeneous communities and there's some that are with specific communities. So it depends on where you're at and what you want to look at. So starting from where you're at, what's going on in that community or what's going on in those communities, and then going from there, utilizing the communities and collaborations and looking at the history and looking at tribal sovereignty and community interest and needs. So this is just a larger way to look at research, and I think as researchers we're doing that. We're trying to do this more often, especially with community-based participatory research. And finally, we have research centers that are helping to bridge gaps. And these are only some of the research centers. As you can see, there's many, many indigenous research centers out there. Shout out to our Black Hills Center over there, and also our Krika people who are here. And then there's also the Karn Center, which is actually having an event tonight. I'm putting a plug in for them at the Doll. I always try to give shout outs when I do presentations. But the Karn Center is doing an event tonight at the Doll, and it's called the Lakota Emergence. And they're having the sous chef there, and so just different mediums of bringing our research to the community and sharing our research. It's being done through these different centers. And we have the Great Plains Tribal Chairman's Health Board represented, and Centers for American Indian Community Health, that's out of KU. Johns Hopkins does some great work. The Indian Country Child Care Trauma Center out of Oklahoma, they do some really great work as well. The Center for Alaska Native Health Research, they're on it. All these different centers have been established so that we can remember the community and remember who we're serving and try to come up with solutions that are collaborative and think about our communities. So, it's an old Indian trick that we know, and we're coming up with different ways to make it more available and to utilize the resources that we have traditionally and contemporarily. So for future directions, and in closing, my goals and how I see tribal research and research with American Indians in the future is building that tribal research capacity. We do that through research review boards like our own, but like Wayne said, we're only one of 3. The Montana, I think it's Tribal Chairman's IRB, is Montana and Wyoming. And then Navajo have one, of course, and we have one. So we need to help tribe establish those, and I know the Turtle Mountain folks are represented here, and they're getting ready to establish their RRB. I know Cheyenne River's been thinking about establishing an RRB, but those are things that we can help protect our human subjects and start to have that conversation with researchers and have sort of like a first step in doing research with Indian communities. Next is just training and education conferences like this. This is super cool, and I want to give a shout out to Liz for putting this together. We're always trying to educate the community. We're always trying to educate other researchers. We're always trying to educate ourselves on research so we can increase our capacity, so we can do better research, so we can bring people in who know what we need and what we want, and we can get results in reducing our health disparities. Ultimate goal is to protect human subjects, but also to increase our, health of our people. And that's through education, and also educating not just like in the community, but at schools, at organizations and departments. We can always evaluate our programs. We can always, see if what we're doing is effective or not. So I encourage schools to do that. I mean, we have school testing and stuff like that, but take that stuff seriously, because that lets us know where we're at and then how we progress. So, and finally, doing a pipeline. So setting up research and scientists in the community. So my position is probably one of its kind, where I'm associated with the university, but I'm also able to work in my home community. And as an American Indian researcher, being able to be home-based is a dream come true. I'm living the dream. And I'm thankful for that, because if people have questions about research, they can call me, they know where I live, they can track me down on Facebook, different ways to find me. And I can answer their questions, and it puts a face with research. And I hope to continue to spread my excitement about research and get other people excited in the community, because it's through that excitement and through understanding that research can help us is how we can build that capacity. Getting people to know what research is, getting students here and getting them to do posters and science fairs, and setting up with researchers at universities and letting them go. And I did the research apprentice program at Vermilion, and that was my foot in the door to research and understanding what it could do for me and my community. And so just starting that pipeline to get more Indian researchers out there, educated, and then back in our communities. And then next is community-led research. So once we get the training and education, then we can lead our research. We can start to do our own surveys and see what our community wants and needs. And I know Yate and Niche did a study, and it was more qualitative, and they did talking groups and focus groups, and they figured out what people in the community were talking about, what they wanted, and what the main issues were. Now it's time for us to use that information to implement things. So doing more of that, doing more of our community-led research, where we ask our people what they want, we observe ourselves, and then we start to implement our own programs. And we can do the implementation of more programs through setting up a tribal research center. And our RRB manages and houses the data, but actually if we had a research center, we could look at that data and continue to crank out stuff ourselves. But right now we can do that with collaboration until we build up to this research center where we have more American and Indian researchers in the community running our own centers, tribally based research centers, through that liaison between outside researchers and our tribal organizations. So that's my goal and my dream, is to have our own tribal research center where we can, when researchers come to the RRB and they say, we're going to do this project, and we say, okay, are you going to hire tribal people? And they say, to conduct your research, and they say yes, we can say, okay, go to our research center. They train research assistants and people who do research. They can give you people who can conduct your research for you. And they're already trained, they're ready to go. They can, and then you can go to our classes that we hold at our tribal research center that can culturally educate you on what's going on here. So if we have that epicenter here where we can train and educate other people here and outside people and continue that collaboration, we can definitely get some cool research and some, not just research, but effects where we have better health for our people. So with that, thank you guys for your time and your attention. I appreciate it. And any questions?